Good afternoon, everyone. Sorry I'm a bit late. Just crazy Friday, usual in the clinic. But it's good to be back in the clinic on a Friday anyway. This afternoon, we are going to be talking about voice surgery, about thyroid shave, everything to do with the neck, really. We're going to be joined today by Mr. Chadwan Al-Yagish, who is a very well known consultant nose and throat surgeon who specializes in voice surgery. And hopefully he's just going to be joining us shortly to cover. Hi, Chadwan.
Hi there. Hi, Chris.
How are you?
I'm very well, thank you.
Good to
All
see
good.
you.
Yourself?
Good to see you.
Thank
Good to
you.
see you. Well done. Thank you for joining us. I think we have a lot of questions
It's
about
my absolute pleasure.
About the surgery and about preparation, post-op results, etc. So I'll start off first of all by what's your criteria for doing voice feminizing surgery?
There is no rigid criteria, basically. The range of male and female voice varies a lot, and there is an overlap, and there is an area where the voice is ambiguous. So I don't have like a strict that's a voice over 170, 180 disqualified person from having the surgery, because most important is we need a voice that matches who we are. It's a figure, how many hertz is just a figure. Yeah. You need a voice that matches your identity, that matches who you are. And then we'll work with a person on individual person to person, see what's their expectation, what's their requirements, how do they use their voice. And then we'll decide where to go from here.
Yeah. And what are your thoughts about voice coaching before having voice surgery?
It is essential, actually. I think having a voice feminization therapy, it can raise pitch, although that varies from person to person. Some people will be naturally be able to reach higher pitch just with the therapy, but others cannot. However, the feminine voice or a female voice is not just pitch. There is the intonation, there is the inclination. How do we use the voice? How we emphasize? How we fluctuate our pitch up and down, and all of these stuff surgery does not address.
Yeah.
So it is a process, and voice therapy is part of that process as well as surgery.
Yeah.
There is generally two approaches to it. So you can either have a full course of voice therapy, normally somewhere around 12 sessions. And if that fails, you move to surgery as a second line. Mm-hmm. And then you go back for some therapy post-op. So that's one way to do it. The alternative way is to go with surgery first, have a couple of sessions to prepare you for the operation, to talk about recovery, how to look after your voice, how to avoid straining your voice post-operatively, have the surgery, then do the block of therapy afterward. And I don't think there is a right or wrong answer.
Yeah.
Which is the better approach of the two.
So what happens when you see a patient for consultation someone who is interested in having voice surgery? What happens at the consultation?
Like all consultation, we start by taking history, background, medical background, voice background, see how their voice affecting them from day-to-day life, how much dysphoria is associated with voice, do they get misgendered often, and how do they use their voice? Are they in a job that requires sitting on Zoom 12 hours a day, like many of people are these days? Yeah. Or is it someone who can hardly use their voice proficiently? Do they sing? Do they act? Do they perform? Because that will have a significant impact on their ability. Yeah. Then general back medical history, stuff that are relevant. Have they had any laryngeal surgery, previous laryngeal or voice problem, smoking, and reflux? These are the areas, and general medical background.
Yeah.
Once we've gone through all of that, in terms of getting what the patient requirement and expectations with their voice, what would they like to achieve? What's their aim? What's their target? Have they had therapy before, and was that successful or not? Mm-hmm. And then examination, we need to do pitch measurement. So we do that for everyone as to establish what's the baseline pitch on reading and free speech.
Mm-hmm.
And we do endoscopic examination, but not always necessary that we need to do endoscopic examination of the larynx. If there is a relevant history, yes, absolutely. But otherwise, we possibly don't need to do endoscopy beforehand.
Yeah, and then what type of things do they need to do to prepare for surgery? So
well, they will need to have the voice therapy if they wish to have the voice therapy. So I always advise 1 or 2 sessions as a minimum before the operation. Apart from that, there is very little that needs preparation. If they smoke, they need to stop smoking 2 to 3 weeks before surgery.
Yeah.
Because if you quit on the day, you will get a lot of coughing afterwards, and that will possibly damage. So you need to get that clear out of your system good couple of weeks at least before the operation. If they have reflux, we possibly need to optimize treatment beforehand. Same if they have asthma, we need to optimize treatment beforehand because to make the recovery easy and to prevent damage to the gluteoplasty.
Yeah, yeah. And how long does the surgery usually take?
So the procedure I do as my first line and is possibly the most effective and most predictable and gives the best result is the endoscopic modified Windler's gluteoplasty. And that will take, it takes me around half an hour possibly to do my part, but it will, there will be anesthetic, having the procedure, waking up, recovery. The whole process will take us around 60 to 90 minutes possibly.
Yeah, yeah. And then you said your kind of preferred option is the gluteoplasty. What are the other options of surgery that you would provide?
So just to give a bit of background on how the vocal cords work. So it's a bit simplistic, so apologies for that. Imagine, best way to think of them is like a strings of a guitar, basically. So if from a string of a guitar, if you want to get a higher tone, you either need a thinner string, and there is an operation to do that, but it's not very good operation, so pretty much nobody does it, which is laser reduction to the vocal cord. Or you need to increase tension, so like tightening the string on the guitar, and that's the external operation, Trichothyroid approximation. So this was our bread and butter operation up till 5 years ago, possibly.
Mm-hmm.
And the operation will involve incision in the skin in the neck, and then bringing the cricoid and the thyroid, which is 2 of the cartilages of the voice box together, and that will stretch the vocal cord and increase the pitch. And the last approach is to shorten the strings. Again, the strings of ukulele will give a higher pitch compared to the strings of a guitar.
Yeah.
And that's what the gluteoplasty does. So the gluteoplasty, we shorten the vibrating segment of the vocal cord by suturing, by stitching the front of the vocal cords together. So you will take away around 40% of the vocal cord area, like the length, and that will raise the pitch. So as a general rule, I will go, unless there is a contraindication for a gluteoplasty will be my first line.
Yeah.
If that's failed or did not achieve the desired results, it can, there is pitch increase, but it's not enough. Mm-hmm. I do Trichothyroid approximation as a second line.
Right.
There is a procedure, they term LAVA, whoever wrote it, so really had to think about the acronym to come up with something cool, which is laser assisted voice adjustment, which is like the reduction, but only involve lasering the upper surface of the vocal cord away from the vibrating edge.
Yeah.
And that will tighten the cord. So this is for minor adjustment.
Yes.
If you need 15 hertz, 20 hertz, you have that option as well.
Yes. Yeah. And is it a day case operation?
Yes, it is a day case, unless there is a medical background that requires stay for monitoring. But otherwise, it's a day case. Yes, a couple of hours, you recover, have something to eat, and then you can go home.
Fantastic. And how painful is the procedure?
It's not that painful. People ask, do I feel it? You're under general anesthetic, so you're not going to feel anything during the operation. The pain is limited after the operation. There isn't much pain, although I do prescribe cocodamol, codeine, and paracetamol. The codeine mostly prescribe it to suppress coughing rather than for the pain.
Yes.
Paracetamol normally is more than enough for the pain from the surgery.
Right. Very good. And so in what are your recommendations for in the post-operative period? How long do they have to stay off work? How long do they have to stop talking, singing?
Yeah, recovery is not easy, unfortunately, and it's not easy because people will need 1 week of a complete voice rest, and by complete is complete, so not a word for a whole week.
Yeah.
I'm very nice and kind compared to others. Some people will keep people 4 weeks completely silent.
Yeah.
I go with 1 week only. So 1 week complete voice rest, and then the second week 2 or 3 words at a time, nothing much, and then build up vocal use gradually over 4 to 5 weeks. So the whole process will take 6 weeks. If a job is voice dependent, I would say at least 2 weeks of work.
Yeah.
If if the job is not voice dependent, or the employer can make accommodation for the person not to use their voice, then you can go back to work after 5 to 7 days.
Yeah. So if you're working on a computer at work, but you're not answering the phones, things like that, then you can go back to work pretty quickly.
Yeah. Yes,
but
absolutely.
if you're on reception having to greet people and answer questions, then that's not a good idea.
Yeah.
Yeah.
Exactly. A minimum of 2 weeks, I would say.
Yeah. Yeah. Good. And so after that kind, 4 weeks, what would the patient expect, or 6 weeks? What would the patient expect to feel like? How when do they see the results of their voice surgery?
So that can vary. So in once they start talking after the first week, some people will start talking and voice is as clear as a whistle, no problem at all, high pitch straight away. Not everyone get that experience. So a lot of the people we operate on, we offer the surgery, will have, when they start, the voice will be strained and a bit hoarse, quite weak often, and that's gradually improve. Between 3 and 4 weeks, it's pretty much where we're going to end up, or close by. The pitch is still expected to deteriorate. The voice can be husky with some vocal fatigue if you use it for a long period of time, around the 4-month mark.
Right.
The recovery of the voice will continue, and around 3 months, that will be the voice that we're gonna end up with.
Yeah. So pretty much following the normal resolution of swelling. Post-surgery kind of follows that timeline with the swelling. So we say to patients, usually 3 months before you see the real result, or
yes, absolutely, because you want. Yeah, exactly, because you will have a swelling on the vocal cord, you will have inflammation as part of the healing process. We put sutures in the vocal cord. These are dissolvable suture. There is a foreign body reaction. The suture needs to break down, and that will take a few weeks. So we're looking into 3 months before with the voice stabilized, and we know exactly where we're going to end up. Yeah.
So would they start back vocal coaching after 3 months or after 6 weeks?
I recommend starting after 3 weeks.
After 3 weeks.
With the therapists that are accustomed to dealing with patients with voice surgery, because you need to start gentle.
Right.
With exercises, to breathing exercises, something deconstriction to reduce the tension in the muscle and stuff like that, but not to push your voice to try to sing and, push the pitch. So it needs to gradually start with that. But 3 weeks after surgery, we normally start voice therapy.
Yeah, fantastic. And in that first 2 weeks, do you recommend any particular cool drinks, ice cream or anything like that?
Most important is to stay hydrated. That's extremely important, because when we close the glottis, we narrow the vocal cord, we change the diameter of the airway. So mucus clearance, especially in the first couple of days after surgery, is quite tricky because you're not used to the new dimension. So the more hydrated you are, the thinner and looser these secretions. So it's unlikely to cause you cough and irritation. Mm-hmm. And on the same token, we advise steaming after the operation. Mm-hmm. So 4 times a day to start with. Yeah. And steaming could be just a simple steaming, a bowl of hot water with a towel over your head. Yeah. Or you can buy a handheld steamer and use that. Yeah. And so for the first week, do that regularly 4 times a day. And then you don't have to do it that frequency from the second week. You can do a couple of times a day, etc. Eating and drinking, there is no restriction.
Yeah.
At all. You can eat and drink normally. If the throat is a bit sore because of the scope we put in, have something softer in the first couple of days, but normally it's all right. You can go back to normal diet pretty much from the same day.
Fantastic. Yeah. And what kind of complications do you warn patients about?
We talk about like any other surgery. There is a risk of bleeding, pain, and infection. None of that is a particularly high risk with the gluteoplasty. It's nice, clean surgery in a clean area. It's not sterile surgery by definition because you're working in the throat, but it's not contaminated either. Specific, there is a risk of damage to the teeth because we go with a scope through the mouth. That will be most relevant if somebody have already dental problem, or if they have bridges. We need to be very careful. We use a gum guard, we use protection and all of that.
Right.
In theory, there is risk of laser injury because we use the CO2 laser. We take laser safety extremely seriously, as you know.
Yeah.
So this is stuff of legend rare for somebody to have an actual laser injury from the operation. And the most important is the chances of failure, that the operation does not work. And this is something we discuss really clearly before the operation, because although it's a good operation, the results are predictable most of the time. It's not 100% guaranteed. And a person who is deciding what's right for them and if this surgery is what they need to do, they need to be aware what's the expectation.
Yeah. Oh, absolutely. We have a good question about managing the airway during surgery. How is that done?
Yes, so normally with general anesthetic, you either put a tube through the vocal cord or you put a laryngeal mask airway, which is stay above the vocal cord. We can't use either one of these because we're operating on the vocal cord. So we use something called jet ventilation. So it is high frequency jet ventilation. So we give a puff of oxygen 100 times a minute. Yeah. And that will be a tubeless surgery. So we don't have a tube in the airway at all during the operation. So that's given either via my scope or via a catheter that goes side to my scope.
Yeah, brilliant. Good. And then questions about, can you combine that with thyroid chondroplasty or Adam's apple reduction?
I do combine it with Adam's apple reduction. Yes, it's like two different operations done under general anesthetic because with a gluteoplasty, there is no need to touch the neck or go externally. So if I'm doing Adam's apple reduction, I do that first, and then we will take the tube out and we start with our gluteoplasty.
Fantastic.
I don't combine cricothyroid approximation with a gluteoplasty. I know other surgeons do in the States, but I think the impact on voice and voice quality with cricothyroid approximation can be quite considerable. Yeah. And people underestimate, and then having both done at the same time might give you quite monotonous, robotic voice. I do not like to do both at the same time. I do gluteoplasty. If we can't achieve where we want to achieve, then we'll have another discussion and take cricothyroid approximation as a secondary operation. Yeah, yeah.
And a really good question. What kind of percentage success would you say for your results?
Yeah, in my hand, I say around 90% success rate.
Wow, that's fantastic.
And the failure is one of two things. One is the suture breaking down after surgery. And although they are delicate sutures, and I stress how important you look after your voice, it's not common. This is quite rare.
Yeah.
The other failure is that the surgery has worked, as in the web has formed and it healed and fully healed, but we failed to achieve enough pitch increase, you know, especially if we're starting low, if we're starting really low. If a person have a deep voice around 100 hertz, going into 180 is a long way.
Yeah.
So we may not achieve that. And both combination of the two is around 10% of cases.
Yeah.
So there will be some increase, but not enough increase.
Yeah, that's very, very good. You know, I've been to a lot of lectures in the US on talking about voice surgery, and they talk about a lot of cricothyroid approximation with success rates down in the 70% kind of range.
Yeah. Yes.
And it's one of the things that, you know, it's a pleasure working with you because, you know, I know that you're doing a great job, and
Thank you.
and you know, it's about making sure that the patient gets, you know, a good result and understands that, yes, with any surgery, there's a risk. What's relevant, just to tell our audience, is that no matter how good as surgeons we are, a lot of the result that we achieve is due to good patient care post-operatively. It's them following our instructions, making sure that they don't strain their voice, they don't start doing anything silly too early. You know, fortunately, we're in a world where we've got lots of SMS messaging and WhatsApp messaging, so they can communicate without talking. You know, so but it's so important that patients understand that doesn't matter how good your surgeon is, and I think you and I are, you know, pretty decent surgeons. You know, to get a good result requires a good partnership between surgeon and patient.
Yeah, it is a partnership, absolutely, and it is tailored to each individual person.
Yeah, yeah, absolutely. That's fantastic. Is there anything else you would like to add?
I think I think we covered most aspect of the surgery. I think cricothyroid approximation as a second line is the success rate is around 70%.
Yeah.
So so you know, I can't claim to be any higher than that. So it is around 70%, as you suggested. But gluteoplasty is far superior operation in terms you get higher pitch, more pitch increase, you will get more natural voice, and it is less invasive surgery.
Yeah. And if someone had some improvement in their voice, but they wanted to get a bit more, at what kind of timeline would you consider doing a cricothyroid approximation?
I would say 3 months at least, because if we accept that the voice is going to continue to change up to 3 months, I would like to give that a chance.
Yeah.
And I would ideally like them to have a good go with the voice therapy, because they might achieve a bit more and they will be satisfied in the overall results.
Yes.
Before putting them through another surgical operation. And if we can't achieve that, then we can move into a cricothyroid approximation as a second line.
Yeah. A good question from one of our lovely patients. Are there any, apart from the change in pitch through the gluteoplasty, are there any changes that you have seen following surgery?
There is a trade-off sometimes, not in every person, but in some people, they lose some of the voice pressure, which means raising voice, shouting becomes more difficult.
Yeah.
And the more you close with a gluteoplasty, the more you lose subglottic pressure. And that's a trade-off. So you need to balance that. But that doesn't happen to every person. Some people maintain their ability to shout and raise their voice as much as they want. Voice projection is not severely affected majority of the time, although some people can complain about that.
Yeah.
In terms of other characteristics, the good thing about gluteoplasty that it maintains the the nature of the voice, so it still sounds like us but more feminine.
Yes. Yeah.
It doesn't give you that monotonous, very narrow pitch range voice you get with a cricothyroid approximation.
Absolutely, yeah, no, totally agree with that one. So you know, looking at different patients' requirements, especially for someone who likes singing or someone who's in the acting profession. Obviously, you know, you would take a lot of time in assessing what their requirements are and making sure that they can continue with their profession, I suppose.
Yeah, acting is easier if you don't sing, although you still need a lot of pitch control for effective acting, but you don't lose that ability.
Yeah.
Singing, on the other hand, if singing is your career or is an essential part of who you are, then possibly voice feminization surgery is not the right option for you, because it doesn't happen to everyone, but it can be career ending, and the implication could be, could be extreme.
Yeah.
So a person needs to think about that very, very carefully, do all that can be done without surgery, including doing full course of therapy, try to achieve all that can be achieved without surgery. And then at some point, it will become down to an individual personal choice. Is it worth it or not? Is the impact on my quality of life higher with my masculine voice, or is losing my ability to sing? And sometimes becomes a difficult question, but it needs to be addressed appropriately.
Absolutely. Yeah. It's a big decision for a patient like that, and they need to understand the benefits versus the risks of pursuing any kind of surgery, and voice surgery in that situation. Very, very important.
Yeah,
that's absolutely fantastic. Information. I think everyone's been very positive about your answers and the discussion. And it's great to have you on board, and hopefully we can be able to do more of these Instagram lives together and talk about different aspects.
Absolutely.
Yeah. No, thank you very much. And
no, it's a pleasure. Thank you very much for having me, and thank you for everyone who joined. And if you have any questions, I'm always contactable. So happy to answer questions, happy to go through things.
Yeah. And so if you have any questions, or remember that Nicole is on there. Just DM Nicole, and she can get back to you. She can put you in touch with Mr. Chagwan, and make sure that you have all the information that you need to make a good decision. Take care, everyone.
Absolutely.
Have a lovely and safe weekend, and hopefully Monday is going to bring a new dawn for the whole country. We can get back to some kind of normal.
Yes, normal life. I look forward to that first meet outside.
Yes, yeah. Well, I look forward to seeing you face to face and having a coffee at some stage.
Absolutely, it will be a pleasure, Chris.
So, take care, everyone.
Thank you very much.
Hope we would keep all well. Thank you very much, Chagwan. Brilliant.
Thank you. Thank you. My pleasure. Bye bye.
Bye bye.
Bye bye.